I'm Dr. Saravanan, consultant neonatologist at Rainbow Children's Hospital, Bangalore. The process of childbirth and labor is a roller coaster of emotions. A few things should be initiated immediately at birth for the baby, and parents should be aware of this and should be prepared for this. The most important here is the concept of zero separation. Once the baby is born and the baby cries, the baby should be placed on the mother's abdomen and the drying should be done on the mother's abdomen. Now, this early skin-to-skin contact is very important and goes a long way in ensuring the maternal and the child bonding. The next important is the concept of delayed cord clamping. Once the baby is born and the baby cries, the umbilical cord should not be clamped and cut up until 1 to 2 minutes after birth. Now, these extra minutes ensures that the blood which is there in the umbilical cord flows into the baby. Now, this extra blood along with the extra iron goes a long way in the brain development of the baby. The last and the most important is the initiation of breastfeeding within the first 30 minutes after birth. Now, this is important for ensuring lactogenesis. In fact, even in a cesarean delivery, it's important to ensure the initiation of breastfeeding within 30 minutes. Sometimes, even when the mother's abdomen is sutured, the breastfeeding is initiated. Yes, this is quite a common question. Do I need to search for a birthing center with a good neonatologist and a good neonatal ICU? Well, pregnancy and childbirth is supposed to be one of the most natural and physiological process. But in this era, where there's a lot of change in natural lifestyle, as per the latest statistics, the neonatal mortality rate is 20 per 1,000 live births, meaning every 2 in 100 babies need some support at birth. In fact, the first breath and the first cry of a baby is very important for long-term brain development. Any difficulty in initiation of breathing at birth needs immediate attention or assistance from a neonatologist. So, a good neonatologist and a good NICU setup is like a good seat belt and a good airbags for a car. More than any of the gadgets, fancy gadgets in your car, the most important is the good seat belt and the airbag, which is going to protect your life in the event of any untoward incident, which may be rare. So it's important to search for a birthing center with a good neonatologist and a good NICU setup. In this era of early diagnosis and good monitoring, diabetes mellitus and pregnancy-induced hypertension should not have any major complications. But it's also important to be aware of a few issues. Now, babies who are born to mothers who have gestational diabetes tend to be a little larger and hence they are prone for any injuries during the birth process. So it's important to have a neonatologist to assess the baby at the point of delivery. Next is babies who are born to mothers who had gestational diabetes are prone for hypoglycemia, that is low sugar. It is very important to understand that any low sugars in the newborn period can have permanent and devastating brain damage. So it's imperative to monitor the sugars of the baby and also ensure that these babies get the right amount of milk at the right time. Babies who are born to mothers with pregnancy-induced hypertension tend to be a little smaller due to growth restrictions. So again, it's important to monitor the sugars of these babies and ensure that these babies get the right amount of milk at the right time. A preterm baby is born before 37 weeks of completed gestation. The most common causes for preterm onset of labor pain are any infection in the mother. It could just be a viral infection in the mother or any urinary tract infection in the mother. Sometimes uncontrolled pregnancy-induced hypertension can lead on to early onset of labor. And last, placental insufficiency, that is when the blood flow from the mother to the baby is on the lesser side, that would precipitate an early onset of labor. True, it is quite unexpected and quite devastating. But preterm babies also in the hands of a good neonatologist is always safe.